So hi everyone, I just want you to take a moment to think about dementia. Around 60,000 people in Ireland are living with dementia now, and that number is expected to rise to 150,000 by 2050. So how can we plan for future care and the future rights of people with dementia in Ireland? And joining me to talk about this is Professor Eamon O'Shea, and Eamon is Director of the Centre for Economic and Social Research on Dementia at the University of Galway. So Eamon, you are a Professor of Economics and Director of this centre, so tell me a little bit about what the centre does, what you focus on.
Well, we focus on the economics of dementia, but the economics of dementia in the context of resource allocation, of how we think about resources going to people with dementia. And as well as that, in a sense, is highlighting sort of the needs of people with dementia. And also we focus on, for example, the public's response to dementia and how much they might be willing to pay for an additional taxation to support people with dementia. We also focus on what sort of outcomes, because economists tend to think a lot about costs, but we also focus on outcomes. And an important outcome for us would be, for example, personhood, the notion of personhood, and the importance that whatever we do, hits that button, if you like, of the humanity of the person. And that takes it then into discussion about the continuum of care and what types of care is provided, from care in the home right up to care in nursing homes and acute care. But it also takes into sort of issues of psychosocial care and the importance of community, of family, of place, and so on. So even though we focus on the economics of it, we try to think about economics in the context of a broad personhood model of resource allocation.
And how do you connect the research then with the policymakers, with the people with dementia? How do you involve those in what you do?
So as academics, obviously we involve people through trying to publish our work, but at the same time, we certainly feel it's really important to have people with dementia involved directly in our work, or certainly influencing our work, and the same with carers. And the sort of over the period of our work, we have involved people with dementia more and more in what we do, and their voice is really important. Similarly with policymakers, although we don't shape policy in a sense, we try to influence the way policy is discussed and the data that policymakers get or have when they're making really critical decisions. So it's bringing that sort of nexus between the practical experience of dementia and caring through economics, through to policymakers themselves, and giving them a lot more information, hopefully to make better decisions.
Well, thank you for the work that you do, Eamon, and thank you for those insights. And you can read lots more about Eamon's work and lots of other HRB funded research projects in Health Research in Action, which you'll find at hrb.ie.